Let's look at a situation where you meet a person who has had a bereavement. If a person has lost someone to death and you find that the person is actually grieving, it's very important to help that person. Bereavement is a loss. Grief is the psychological reaction to the loss, and mourning is the social reaction to the loss. We are all aware of different stages of grief, and the most popular ones were given by Elizabeth Kubler-Ross, and which were called as DABDA or DABDA. So, when a person encounters a severe loss, for example, a death of a person, the first phase is one of denial and disbelief. And the person, finds it very difficult to accept that somebody has died. This can be followed by anger. Anger itself, that I could not do anything for the person to save the person. Or anger at the person who died, that why did he die at such a time when, the person was required for so many things. Anger at God, anger at the hospital, anger at the doctor, anger at everyone. So anger is another reaction during grief. Then it was followed by a stage what we call as bargaining, where a person thinks that, well, how I could undo this. If I did so and so thing, maybe this person would come back. Or if I could, pray to God or do something else, in a bargain to get this. When we find none of these things work, the person goes into depression. And depression can be really for many days and weeks and months. A normal grief can last up to 1 year. Normally we say about 6 months, but in many situations it can last for up to 1 year. And if the grief lasts longer than that, it is called prolonged grief, and many times we need to intervene. So after the phase of depression, there is a phase of acceptance. When a person thinks that, well, accept that the person who was being lost and has passed away will not come back, and they live life, in the absence of the person. The memories of the person will never go away. The person would always be remembered, but the sad memories related to grief are replaced by more positive memories of happy times with the person. So when I talk about stages, they need not necessarily come in that sequence in which I mentioned. Sometimes it can just start with anger. Like you see in hospitals, in an emergency, when a patient is taken there and the person dies, and the relatives go into anger straight away. And they are angry at the hospital, angry at the doctors, not that it is justified, but then it is the anger which manifests there. Or a person may start with feeling sad and depressed, and later on can have denial, or later on can have anger, So, or the person might accept immediately, because that is also a way of dealing with the situation. But that acceptance might be short lasting, and again the person goes into disbelief and depression. So, grief can be of many types. Grief can be oscillating because it can go up and down, and there can be moments and memories which can make the person feel sad, and then when the person snaps out of it, and the grief can oscillate. Sometimes the grief manifests in the form of the person keeps the objects like the clothes or the other toys or books, and they cannot get rid of them. So they live with them as if the person is still living and alive. So, or the grief might be so severe that a person might think that what's the point of my living, and it might become a suicidal risk or a risk to harm to themselves. So there can be very acute grief. There can be slow and subdued grief. There is something called as secondary grief, where a person develops a psychiatric disorder or a medical disorder following a death. So a person gets anxiety disorder, gets panic attacks, or a person feels sad and depressed and gets a depressive disorder, a person becomes a psychotic, gets psychotic symptoms, or a person starts drinking, or a person starts abusing medications and drugs. So there can be different ways how people cope with their grief. There are healthy methods, which is a natural grieving process. There are unhealthy methods, like the use of substances and alcohol to cope with it, or there might be untoward complications, like when a person develops a psychiatric disorder. How does one help with grief? It requires personal support, social support. That is why mourning is quite helpful, because mourning is a social phenomenon. A lot of people come and talk to the person about the dead person or the person who has been lost, and the memories which were distressing gradually become more and more easy to talk about, and the person is not as sad or depressed as they were in the beginning. So social support is very important. Sometimes if you think that a person is not getting benefit from that, then it's important to get a mental health professional to provide some grief therapy, or to many times a person can have developed medical disorders like a cardiovascular disorder, or any other psychosomatic disorder because of the loss in the person. So people have different ways of dealing with that. It's many times they might have religious methods or spiritual methods or medical methods or their own methods. There is no one method which can be recommended. Different methods work for different people. Remember, grief is a natural, normal reaction. All of us are going to encounter grief. One should also remember that there are certain situations where the grief might be much more severe. If the loss is sudden, if the loss is unexpected, if it is a loss of a young person, a child or an adolescent, if the loss is of a person who was physically healthy or psychiatrically healthy and still the person passed away, these make it the grief much more severe. If a person is unable to participate in the rituals or the funeral, or does not get a chance to see the body of the person and be able to express their feelings, these are some of the situations where the grief reaction might be much more severe, and it requires specialized dealing and handling by a professional.